Dear delegates, a very good morning to you all. Welcome to the annual conference of Bangladesh Society of Cataract and Refractive Surgeons. Today, my talk is the marking for Toric IOL. So when we talk for the marking of the Toric IOL, we will be focusing on the reference marking and the axis marking. So what is the reference marking? It's always we do pre-operatively, and it's usually to 0 to 180-degree axis in case of left eye or right eye. And it should be done in the sitting position to the patient. And the axis marking, it is done pre-operatively or par-operatively. The axis marking is the calculated axis where the dot of the toric IOL is aligned. So when we are talking about this alignment, we need to know why this alignment is very important. We know that for every degree of IOL rotation, 3.3% of lens cylinder power is lost. So, for example, the patient has the astigmatism of 2.5 diopter, and there is the error in the pre-op marking occurs 5 degree, and error in the intra-op alignment is 5 degrees. So we have the total 10 degree of error of alignment. So when there is a 10-degree error, there is a 33% loss of astigmatism. So the patient of 2.5 diopter of astigmatism, we are correcting only 1.75 diopter instead of 2.5 diopter. So there is actually residual 0.75 was not corrected. So this is very important. And the picture shows that pre-op reference marking, that is the horizontal to the eye, that is we usually do in the temporal side, and the intraoperative axis marking, what we usually do. In case of reference marking, we can do freehand marking, we can do bubble marking, or the marking by the slit lamp. So when we do the freehand marking, we have to keep in mind that patient should be in sitting position, and it's better practice to keep the patient's head against the wall, and we need to dry the cornea, because in wet dry cornea the marking could go for smudging or it is fade, and we need to hold the torch by our assistant straight to the eye, and the marking person is best to do by the surgeon by himself or herself. Sit little bit aside that patient can look straight to the torch or source light. So when we are talking about this torch, the light reflex, we need to follow the corneal reflex, because the corneal reflex should be in center, and that we can draw an imaginary line, and with the imaginary line, we can easily draw the reference marking, which is what I told, that is temporally, that is 0 in case of left eye and 180-degree in case of right eye. So the middle picture is the correct. And in case of this marking, the mark should not be irregular. It should be like a dot or a straight line that we can easily understand where it started. So before doing the marking, we need to do topical anesthesia. This is the very must thing. Otherwise, patient cannot do, will not allow us to do the marking. And we have to instruct the patient where to look. And this, the freehand marking. This is the eye. We just put a line that make as a reference marking. We can also do it by slit lamp. The Zeiss slit lamp has the axis marking system, and here this is 90, and if we want to do the 180 degree, just we can rotate it, and here it shows that 180 degree, and the beam is parallel horizontally. And when the beam is horizontal and it gives us the mark of 180 degree, we can just make one reference marking here. We can also do axis marking by the slit lamp also. But when we are doing the reference marking, so how we can understand that this reference marking is actually 180 degree or little bit apart? There are now in the advanced world, there are two mobile apps that makes us very easy for the confirmation of the reference axis. One who is using the Android app for the Google Play Store, iToric by Patvardhan, and another is the Toricam by a great Dr. Graham Barrett for the Apple users, are available in the market, and it's free to download. So we can easily understand that our reference marking, what is the actual axis of our reference marking by these two apps. But one thing, that when we use this mobile device, we need to keep in mind that the head of the patient should be stabilized, and the head of the patient, look at this picture, the head of the patient and my mobile position should be parallel. The mobile position should not be tilted. If it is tilted, it could give chance to an error of my reference marking. And also when we have to take the picture, we have to look the corneal red reflex, and the limbal line should be in the center, and our corneal light reflex should be in the pupillary center, and the middle picture is correct. And this is the Toric cam. Just we took the picture. That's a very easy apps by Dr. Graham Barrett. Just we take the picture, and this picture, when we give the manual reference marking, this picture gave us that what is our actual reference marking. Look at the first picture. It is our manual marking is accurate. This is 180 degree, and another picture, this is we intended it for 0 degree, but it is 1 degree. So if we have a little bit 5 degree or 175 degree, this also indicate that what is the reference axis by this app. Now we go for the iToric. It's a very good app for the Android user. That what we need to do, we have to align the corneal reflex at the center, and then we will take the photo. And then what we do, we will manually align the cornea with the circle. Look at this. Then after that, we drag the one point and at the mark, and another through the center of the circle, and that give us the misalignment. Look at this, the rotation, mark rotation is indicated that it is 17 degree. So my misalignment is 17 degree, and though this is the left eye, my reference marking is also in the 17 degree. So that comes to the axis marking. Axis marking is where my toric IOL dot will be aligned. So for the axis marking instrument, these are the instrument set, and we have to use the Mendes ring, because the Mendes ring have the axis marker here, and this is the manual axis marker. So before the axis marking, we need to understand that where I did my reference marking before placing the Mendes ring. Because look, in this first picture, there is the mark rotation was 35 degrees. So my reference marking is, it is this minus 35 degree. This is called minus 35. And so when I put the reference Mendes ring, my Mendes ring 155 degree should be aligned with the my reference marking 155 degree. Then I will proceed for axis marking. Otherwise, the toric IOL axis calculation will not be correct. And this is the video, the reference marking. This is the axis marking, and just 180 degrees the reference marking was there, and 20 degree was my axis marking, and we place it sharply there, the with the ink. And we always need to remember that if there is any chance it becomes fade, we need to enhance it during the surgery. We never compromise with this axis marking. And nowadays, life become more easier because of digital marker like Varian and Callisto is here. What it does the pre-operative count, and after the pre-operative count, we take it to the OR and set it with the machine. Here we are showing the Callisto machine, and then the machine gives us the axis of alignment. And look at the picture. There is the blue line is here, and blue line is my axis marking where my toric IOL alignment should be done, and we align the toric IOL with this blue marking. In the new generation of the Callisto machine, it is 3 blue lines, so it gives more accurate thing. But this machine, and this is the alignment of the axis, and so the axis marking is done with the digital marker. So the take-home message for the beginner, we need to start practice the freehand marking. Then we can go to slit lamp marking, digital marking. And for every surgeon who are doing the toric IOL, it's a good to install Toricam or iToric app. It makes life easier. And when we do the marking, when we do the reference marking, when we do the axis marking, we should be patient, never to hurry. And Always we need to remember the meridian of reference marking when we doing the intraoperative axis marking, because if we calculate wrong reference marking, the axis marking will be wrong and the toric IOL placement will be wrong also. That will be a very bad for the patient as well as for the surgeon. And I want to say, end my talk by saying the great talk by Dr. Graham Barrett, who has lots of contribution in this toric IOL calculation that determine the exact location of reference axis when implanting toric IOL increases the rate of success. And remember, knowledge upon location and direction is required to arrive at one's destination in life as well as in the cataract surgery. Thank you very much. I would like to take any question if there is any. Thank you very much.